Hello everybody, Dr. Patel here. Hope you all are doing well. First and foremost, just want to apologize for not being able to do this talk last week. I was supposed to, but had technical difficulty after technical difficulty. But I'm glad that we're up and running, and thank you for joining me. If you are interested in this topic, if you find this helpful at all, please share it, like it, subscribe, all that fun stuff. If you are not catching me on Facebook Live, these videos are going to be put onto our YouTube channel and on our website, fxregencenter.com. If there's any topics that you want to talk about, or if you have any questions or concerns, then by all means you can always comment, DM, or email us at info@fxregencenter.com. So today we're going to be talking about something that I see actually very, very commonly in my patient population, and that is called hypermobility. Hypermobility is something that you may or may not have heard of, but you've probably heard of people being double jointed. Especially as kids, you might have known that kid that was always able to do funky things with their fingers or with their arms or with their legs. Shoot, you might be that kid yourself. This is something that's very, very commonly seen in younger kids and even young adults. And it's not necessarily something that's wrong or odd or weird. That could just be a very, very normal thing. But there is this concept of hypermobility that actually really has a spectrum of different normal and abnormal conditions that are associated with it. So what does hypermobility refer to? Hypermobility refers to looseness of our ligaments. Specifically, the ligaments are the things that connect bone to bone. And these are things that connect all of our bones throughout our body. And these ligaments are created with various different tissues such as collagen, and there could be issues with this that can cause your ligaments to be looser overall. But it's a really interesting spectrum of various different conditions and again even normal situations that can cause hypermobility. So I'm just going to outline first and foremost what are ligaments, number one. Number two, what are the possible causes of hypermobility? Number three, I'm going to go through what are the ways that we can test for hypermobility. And number four, what are the things that we can do about it? So first and foremost, just to kind of delve a little bit into more so the structures of ligaments. As I mentioned, ligaments are essentially what connects bone to bone. So if you think of your bone here, you like that? It's a nice little bone. And let's say we're connecting to another bone here. Well, all of the things that are holding those bones together are called ligaments. Now, a lot of people describe ligaments as the duct tape that connects bone to bone, but in actuality, ligaments are like those thick rubber bands that surround broccoli in the grocery store. And if you've tuned into any of my talks before, or if you've seen me in person, then I use that analogy quite a bit. Because, quite frankly, that analogy is very, well, not very, but pretty accurate. Pretty accurate. Because if you think about those rubber bands that surround broccoli in the grocery store, they're thick, they're strong, they're supportive, but there's a little bit of stretch to them. And that's really what ligaments are like. Ligaments have to have some stretch to them, unlike duct tape. They have to have some stretch in them to allow for us to have motion. Otherwise, we'd be very, very stiff throughout. Now, part of the reason that we start to get stiffer as we get older is because the normal elasticity of our ligaments does start to decrease over time. So our ligaments do get stiffer over time, and that does contribute to some of that stiffness that we feel as we get older. And when we're kids, when we're super young, our ligaments are super loose. that's what allows kids to fall down, twist their arm, twist their leg, and then quite literally bounce back up. That's because they're super flexible, and that's the ligaments are a part of that. So what is it that can cause the ligaments to get looser? Well, loosely, there's a few different categories of hypermobility. First and foremost, one thing that most people think about when we think about hypermobility is genetics, so your DNA. So in this genetic category of hypermobility, the common thing that we learn about in med school is a condition called EDS, or Ehlers-Danlos syndrome. Now, EDS is actually a spectrum of various different genetic conditions, and there is a subtype of EDS called hypermobility EDS, or HEDS, which has the predominant characteristic of having these loose ligaments throughout. Now, what's interesting about hypermobility type EDS is that we still don't know 100% what causes that. We haven't really identified the true root genetic cause at this juncture. And there's no specific, blood test or anything that we can do to specifically identify HEDS. Although you can test for other genetic types of EDS and find out if there is another component that could be causing that hypermobility. But the diagnosis of HEDS we'll get into in a minute. But ultimately, this has to do with kind of connective tissue laxity that could take place throughout our body. This could be very commonly seen in families. It is likely an autosomal dominant genetic trait. So this is something that you'll see kind of passed down from family members to family members. And there are even some subsets or mixes of symptoms and things that you'll see in these patient populations. But these kind of things, EDS could have a lot of various different symptoms associated with it, including musculoskeletal conditions that are secondary to the hypermobility, but also various other things such as fatigue or sleep disturbances. Also, related to the hypermobility, we can have things like craniocervical instability, and even things like that could potentially be associated with that, such as postural orthostatic tachycardia, or a significant increase in our heart rate when we have different body positions. We could have GI or gastrointestinal issue concerns, and even cardiac concerns that are associated with EDS as well. So we think of kind of EDS as being the predominant, hypermobility type EDS being the predominant genetic condition that has hypermobility associated with it, but there are other conditions that could potentially have that as well. I have one patient who we're unclear what genetic condition she has, but she is a very, very active athletic patient who has had multiple injuries associated not only with her hypermobility, but with the fact that she actually has the genetic inability to feel pain. Really fascinating. I have not ever had any other patients with that type of genetic condition, and we don't quite know exactly what's causing it in her situation, but she has some pretty significant hypermobility associated with her symptoms as well. So that's yet another type of genetic condition that could be associated with that. Other conditions such as Marfan syndrome can be associated with hypermobility, and there are probably a slew of other genetic conditions that have some level of ligament or collagen conditions associated with it. So we have those that have the genetic variety of hypermobility. What about those that don't have a clear genetic condition? People can have specific joints that even just have more hypermobility than others. So for example, I've seen patients that have just significant looseness in their shoulders only, and they've had issues with their shoulder kind of coming out of socket or getting dislocated in the past. But when you look at other parts of their body, they don't necessarily have looseness to the ligaments in other areas as well. So you could have a hypermobility joint syndrome, or a specific joint, or more than one joint that has looseness to the ligaments that's unassociated or not really throughout the body or diffusely. Now, whether or not that's a genetic condition that we just have not yet identified, it is unclear. And these things could also be associated with not necessarily nature or genetics, but nurture, or the things that we have done environmentally over the years that could have contributed to a joint becoming hypermobile. So what do I mean by that? Another category that I loosely put hypermobility is those that have had some kind of self-inflicted hypermobility, and then those that have had hypermobility inflicted on them. So I put this loosely because really these two categories are, for all intents and purposes, can fall into one and the same, which is that an environmental factor, an accident, repetitive injury, something that has caused hypermobility to occur. So the classic example of this for the self category, somebody that has sought out an activity that has then led to hypermobility. What is something that can do that? Well, my daughter, who's 3 years old, is very athletic already at her age. She's, super flexible, super hypermobile, but again, she's a 3-year-old, so that could be completely normal. That being said, she's also very strong, and we found out that she had a real strong interest and inclination towards doing crazy things like gymnastics. So we actually recently, over the course of the last month or two, put her into gymnastics, and she's been loving it. She pulls herself up onto a bar and flips around and all this crazy stuff. But with gymnastics, that's one of those fields that, are you attracted to it because you're athletic and you're hypermobile, etc., or does your interest in it and your practicing in it and your constant activity with it cause us to be stronger and also simultaneously more hypermobile, right? The same thing could be said about dancing, the same thing, particularly dancing such as ballet. You think of people that are doing ballet as very, very flexible. You think of other things like yoga or even Pilates to a certain extent, but things like yoga can cause some very real benefit in patients that need that flexibility. But for those that might be already hypermobile, that's something that can certainly cause that ligament laxity or looseness of the ligaments to become more increased. So things like ballet, yoga, and various different sports and activities that can cause hypermobility. We see hypermobility in things like shoulders with pitchers, right? If you think of someone like a baseball pitcher, that's constantly bringing their shoulder back into external rotation, that can cause this looseness to the anterior capsule of the shoulder that allows for then increased external rotation to take place more and more and more and more over time. And that is, to a certain degree, somewhat of a form of hypermobility that is self-induced. So how does that happen? How do our ligaments get looser? If you think about it, again, going back to the thought process that these are these thick ligaments, these thick rubber bands that surround broccoli in the grocery store, if you take one of those rubber bands and slowly stretch it over time, then that rubber band is going to gradually get looser. And that's exactly what happens in these situations. Similarly, this can happen with a trauma. If you get in a car accident, or you get, let's say you get rear-ended and you have that whiplash event occur, right? That sudden whiplashing event can affect the ligaments in our neck. That stretches out the ligaments that surround our facet joints and various other areas, and that can cause some looseness of those ligaments. Now think of, people that have had multiple car accidents, right? Multiple car accidents can certainly cause that. Now, another thing that kind of falls into the trauma category, but it's not necessarily a trauma like an accident, is when you have a smaller, more repetitive injury that can occur that is not necessarily self-inflicted, but is inflicted on you. So what am I talking about? I'm actually talking about manual therapy or manipulation. I'm a believer in manual therapy. I think that it can be absolutely wonderful. As a doctor of osteopathy, I am trained to and do use osteopathic manipulative medicine as a part of my practice. However, I have actually shied away from doing a lot of cracking maneuvers. We have some similar techniques to chiropractors that also are kind of famous or infamous by the fact that there's some cracking techniques that are used. Sometimes those cracking techniques can be absolutely wonderful. In my opinion, they should be very focused techniques that are used for specific joints individually. But there are a lot of folks out there, whether they're chiropractors or DOs or otherwise, that will very commonly do more gross cracking movements. And when I say gross, I don't mean disgusting, although they can be sometimes. When I say gross, I mean involving multiple different regions and not very targeted. And those type of cracking maneuvers that can, make these cavitations or noises that put you back into position and all that, can release some endorphins and can feel good temporarily. But imagine doing that on a regular basis over and over and over again. So unfortunately, there has been a growth of these clinics that are these kind of, manual manipulation mills. There's this locally. There's a chiropractic franchise that's literally built on the model of like 5-minute visits that you can go in whenever you want to. And when you go in, it's not really a thorough diagnosis that takes place, but you go in and crack, crack, crack. They crack your neck, crack your back, and you're going out the door. That could be a very, very dangerous thing. Because if we're not specifically targeting things that are that may be dysfunctional, and we're just cracking things for the sake of cracking things, what exactly are we doing? Number one, we're not actually treating anything, and number two, more importantly, we run the real risk of causing us to have some induced hypermobility. We're actually causing hypermobility because we're constantly taking the joints to an end range of motion and ultimately taking that rubber band and stretching it. I've spoken to some chiropractors that understand this and are very, very cognizant of the power that they hold in their hands and use, cracking type of high velocity maneuvers judiciously. On the other hand, I've actually talked to some folks that literally don't believe in the concept of hypermobility. And if you don't believe in the thought that we can actually loosen the ligaments, then that's actually a pretty dangerous thing. So, over manipulation is something that can lead to hypermobility related symptoms, and that's something that's induced. Now, imagine if you fall into the category of genetic or diffuse whole body hypermobility, and therefore you're naturally a little bit looser, and therefore naturally your joints may feel like they go out of position. So imagine if you're in that situation and now you're going to a manual therapist that's constantly putting you into position over and over and over again, sometimes even multiple times per week. Well, now you're taking a fire and adding fuel to it, right? You're taking a situation in which a patient already has some baseline hypermobility and you're causing more issues. You're causing more trauma. So this is a very, very important concept to consider. On that note, one thing that I have seen quite frequently is when people get in a motor vehicle accident, for example, and when they have this whiplash type thing occur, when we have these ligaments that get looser, and you lawyer up because you just got rear-ended, your car got totaled, and all that kind of stuff, right? Unfortunately, the way the personal injury world has developed is that oftentimes you're going through an algorithmic approach to your medical care, and with car accidents and personal injury, especially when it comes to neck and low back pain, things along those lines, one of, if not the first line medical treatment that we receive is manual therapy through a chiropractor, which can, again, be perfectly reasonable, but it has to be used judiciously. And in actuality, when we have something like a hypermobility condition occur, especially with trauma, then yeah, the manual therapy may be okay to calm down the muscle tightness and spasms and all that kind of stuff. But instead of trying to manipulate the neck and get it back into the right position, we actually should be strengthening the muscles in order for your body to recognize what position it should be in. So instead of something like chiropractic, we should be hitting physical therapy as the mainstay, exercise therapy as the mainstay, with things like chiropractic manipulation as an adjunct. But unfortunately, the world of personal injury is kind of the other way around. I'm going to rub people the wrong way by saying that, because I have chiropractor colleagues that I love and I trust and I think are amazing with their hands, but the reality is that the system is broken because it feeds the mentality of, all right, let's get in and out, let's get a quick chiropractic adjustment and be on our way, because it provides that temporary relief. Unfortunately, that temporary relief comes with that baggage of potentially causing hypermobility to get worse. So what do we do when we have situations of hypermobility, and how does that present in as far as musculoskeletal conditions are concerned? A very common thing that I see with hypermobility is when somebody presents with an issue that, let's say, that the muscles are just constantly getting tight, right? Your muscles are constantly getting tight. You've tried massage, you've tried chiropractic adjustments, you've tried physical therapy, you've tried things like trigger point injections into those muscles, all of which has temporary relief, right? It calms down those muscles. You've tried oral muscle relaxant medications and it calms down those muscles, but then those muscles just tighten up again. That's a very common presentation when somebody has a flavor of hypermobility, and the reason for that is the muscles are ultimately the great reactors. Those muscles react, they tighten up because they're trying to do their jobs. They're trying to tighten up in order to protect the neck, to protect the joint. They're trying to tighten up in order to provide stability where there is not. But then when they're tightening up so much, then those muscles start to spasm. Those muscles then become a pain generator themselves. So the looseness of the ligaments, number one, could potentially cause pain themselves. But even in the absence of the ligaments causing pain, if the ligaments have gotten loose for whatever reason, then the muscles tightening up and spasming could be the ones that are causing pain. And if you think about that, since those muscles are trying to do their jobs, if we're just trying to relax those muscles with medications, with trigger point injections, with massage, but we're not dealing with the underlying stability of the joint, then number one, the muscles are just going to freak out and tighten up again. But number two, those joints being loose are going to then get aggravated themselves. And this is when we end up getting layer upon layer of different things that are causing pain in the region. For example, if you have a whiplash condition of the neck, and now those ligaments are loose, and now those muscles, we're treating them with muscle relaxants in order to relax those muscles, but then those ligaments are still loose. Well, now those joints are going to start to get aggravated, the discs are going to start to get aggravated, the nerves in our neck are going to start to get aggravated, and it ends up being layer upon layer upon layer of things. And that's with the spine, that's with the neck when we think about something like a whiplash condition, but this effectively can happen in multiple different areas. This could happen for joints like the knees, right? The knees that are kind of loose, whether you have a genetic or environmental cause of your hypermobility. If the ligaments are loose in the knee, then over time, that knee itself can start rubbing, the joint itself is going to start to get aggravated. Now, over time, if the muscles are not freaking out and necessarily providing support to those joints that have loose ligaments, over time the bone itself is going to react to that friction, that excess friction, that excess instability that it feels there. And the bone, or first the cartilage, is going to start to wear out, and the bone is going to be like, hey, there's a lot of friction over here, right? There's a lot of motion going on here. And the bone itself will then react to that excess motion and bulk up in order to try to provide stability. And that bulking up of the bone is what's ultimately called bone spurs. So bone spurs that are associated with osteoarthritis and the changes of the bone that take place as osteoarthritis or degenerative joint disease gets worse is ultimately a reaction to the loose ligaments that have occurred over time, whether genetically or whether due to injury. So this ends up being a very important and critical thought process, because it kind of changes the way that we should be trying to manage ligament conditions. We should be managing this hypermobility by ultimately, instead of relaxing the muscles, we should be trying to retrain the muscles, trying to get the muscles to work efficiently, to get stronger, to actually be able to support the area when the ligaments are not able to. In addition, there are things that we can actually do to help strengthen the ligaments themselves. Now, the ligaments, unfortunately, are unlike muscles. We can't do specific exercises to strengthen the ligaments. But if we get the body in the appropriate position that the ligaments are no longer being stretched continuously, then ligaments actually have some decent blood supply. And if it's an acute injury, if it's something fresh, it's something new, then the ligament can potentially heal on its own. If there's a genetic condition, or if this is ligament looseness that has been repetitively injured over time, or if it's an old injury that caused ligament laxity that nothing was ever done about, then it's harder to actually heal that ligament without some external intervention. The good news is that there are things that can be done procedurally to actually help ligaments strengthen, and those are things like injection-based treatments such as prolotherapy, or orthobiologic treatments such as using a patient's own blood growth factors called PRP, or platelet-rich plasma. These type of injections actually induce some level of healing to occur. Prolotherapy, for example, uses sugar water, and that sugar water injected along ligaments can actually cause a little irritation, trick the body into thinking that it's a new injury, and cause some level of strengthening and healing to take place. And PRP, the platelet-rich plasma, is a stronger treatment that actually invokes the healing process more directly. So all in all, there are a lot of things that can be done. In an ideal world, putting the genetic components of hypermobility aside, in an ideal world, when we have an injury or multiple injuries that lead to hypermobility, being cognizant of the fact that there may be some hypermobility or ligament looseness involved in the injury, very, very important, because the earlier we address that, the earlier we avoid things like excessive manipulation of the joint, the more we avoid things like whatever action there was being done repetitively that was causing that looseness of the ligaments, such as if we are involved in a sport or activity that constantly causes stretch. And the earlier we figure that out, the earlier we recognize that, the earlier we can start strengthening the muscles appropriately, getting the body into position appropriately, that the ligaments may have the opportunity to heal. But if things have gone on for too long, we can address these ligaments with appropriate image-guided injection treatments to target these ligaments and get them stronger. And believe it or not, that is a strategy that can work for genetic conditions like hypermobility type EDS. Because with EDS and other genetic conditions, your ligaments are genetically going to be looser. So it's going to be, even if we take away the additional activities or traumas or manipulation that may be causing that hypermobility to be worse, we still need to address the ligaments themselves. And that's where these biologic injections can actually play a really, really good role. And I've had some patients with EDS do really fantastic with these procedures. So in summary, there's hypermobility involves looseness to your ligaments. The ligaments are the duct tape that connects bone to bone, but it's actually like those thick rubber bands that surround broccoli in the grocery store. And the looseness of those rubber bands can be caused by genetics. It can be self-inflicted by activities such as yoga or various sports or ballet or dancing and various different things. Or can be induced by trauma such as a car accident, or also trauma that's induced by repetitive manual manipulation such as chiropractic treatment. But good news is there are things that can be done about it. So if you have questions, if you think that you have hypermobility, there are ways, there's physical examination maneuvers that can test for if we have hypermobility. I'll put some posts up about how to test yourself to see if you have hypermobility. It's harder to do these physical exam maneuvers when you're a kid because you're going to be a little bit hypermobile anyway, but as you become an adult in your 20s, 30s, and beyond, doing these tests can help you figure out if you do have hypermobility as a part of your system. If you have questions about EDS or think that you might have EDS, there are various different websites that are associated with it. You could literally look up EDS hypermobility and a bunch of websites will come up. The Ehlers-Danlos website, Ehlers, EHLERS-DANLOS.com, is very informative. There are various other websites. NIH has a great EDS page as well. But there's a lot of information that's out there, and I implore you to think about that if you think you might have a genetic predisposition to EDS, or if you've had family members that have had hypermobility and you yourself also have hypermobility. Definitely something for you to look into more. If you have questions about hypermobility, about the diagnosis, the treatment, or anything, then please feel free to comment, DM, or email us at info@fxregencenter.com. You can contact us by those means if you have any other topics that you want me to address in any way, shape, or form. Looking at our comments right now, Kathy says, "Hi, Dr. Patel." Hi, Kathy. Thank you so much for joining. Always appreciate your support. And I know Kathy's one of our biggest proponents, and I really appreciate you for spreading the word. So if anyone else also enjoyed this talk at all, then please share it, like it, subscribe, all that fun stuff. And again, feel free to reach out if you have any other questions. I wish you all a happy weekend and a great week ahead. I look forward to seeing you next week where we're going to explore other topics. So best wishes to you. Have a good one, guys.